Dr. Jeffrey Thaxton, a board-certified plastic surgeon. Thank you for watching. I'm going to talk with you about saline and silicone implants. There are advantages and disadvantages to both of these types of implants. First of all, saline implants. There are advantages to saline implants. One, since they don't come filled from the manufacturer, but are filled once they have been inserted, we can make a somewhat smaller incision in order to insert the implant. And also, they have some adjustability of the volume once they have been inserted. However, there are disadvantages to saline implants also. First of all, because they're filled with saline, they tend to slosh around a little bit. They don't hold their shape quite as well, and you can get some rippling deformities, and they don't feel quite as natural as silicone implants. On the other hand, silicone implants, which I was part of the clinical investigating team several years ago that determined that they were equally safe to saline implants, are filled with a jelly-like substance. And that jelly-like substance is not a liquid, and hence the term gummy bear implants or gummy implants. They tend to hold their shape a little bit better. They, again, are filled with a jelly-like substance, and therefore they don't tend to ripple quite as much. They hold their shape better. And also, if the shell, which whether it's a saline or a silicone implant, the shell is made out of silicone. If the shell of a silicone implant were to get a hole in it, this jelly-like substance can squirt out, but as the pressure is let off, basically that silicone jelly retracts back into the implant. So it doesn't tend to deflate like a saline implant would once it gets a hole in it. So if you have further questions about saline or silicone implants, please don't hesitate to call my office and I will be happy to discuss them in further detail. Thank you for watching.